State health insurance exchanges, which will also be called marketplaces, are going to be open for business January 1st of 2014. And in fact, open enrollment for participation in these exchanges is going to begin October 1st. Every state and the District of Columbia will have an exchange. Some states are running their own. Some states are allowing the federal government to come in and run their exchange, and other states are operating in partnership with the federal government. For most plan participants, nothing will change. They'll continue to get their health benefit coverage where they receive it now. These health insurance exchanges, or state marketplaces, are really designed for people who don't currently have health insurance coverage. Under the Affordable Care Act, all Americans are required to have health insurance coverage or pay a penalty. In these public state health care exchanges, the government is going to provide a subsidy for low and middle income people, those earning below 400% of the poverty level of household income, to help pay for their health insurance coverage. The coverage that's paid for through government subsidies is going to be keyed off of the silver level, and a silver level plan means that about 70% of health care expenses will be covered. Certainly, trustees of multi-employer plans, as well as everyone involved with a multi-employer plan, contributing employers, fund administrators, union officials, and plan participants, are going to be hearing about these state health insurance marketplaces, these exchanges, and they're going to be wondering whether these are alternatives to multi-employer plans. It's the right question to ask. Trustees should be asking about state health insurance exchanges. Trustees have a fiduciary responsibility to do so. But there are a number of concerns with these exchanges and a number of reasons that will make them problematic for participants of multi-employer plans. There are a number of concerns with the public exchanges. At the top of the list is whether the exchanges will be ready, or whether every state will be ready by January 1st. The exchanges are also likely to have benefit plans that are more limited in coverage or more limited in their networks. Premiums on the public exchanges are going to be based on a participant's age. That's very different than a multi-employer plan is today. There are likely to be complexities in enrollment in an exchange and some confusion, particularly in the first year. And for plans that are operating in more than one state, there's the added complexity that each state is going to have its own exchange, and some of those exchanges, some of those marketplaces are going to be run by the federal government. While the differences might be small, they might also be significant. Multi-employer plans continue to provide both participants and contributing employers with a number of key advantages. First of all, multi-employer plans are group-based plans. Plans that are going to be on state health insurance exchanges are individual coverage type plans. In a group-based plan, the plan of benefits, the network, can all be tailored directly to the demographics and the specific needs of the group. The plan can be set up really to match the needs of participants in a particular industry. Within an industry, multi-employer plan participants have portability. They can work for more than one employer, and contributions continue to go into the industry's multi-employer plan, providing them with a continuity of coverage. For contributing employers, all of the advantages of multi-employer plans continue to exist even with the Affordable Care Act. Contributing employers pay contributions based on a collective bargaining agreement into a multi-employer plan. In most cases, they only pay on actual hours worked, and unless they're a trustee of the multi-employer plan, their obligation of an employer ends with making the contribution. Someone else worries about the administration and the ongoing structure of the multi-employer plan. we are working with our clients to review this issue in particular, as well as looking at everything they're required to do under the Affordable Care Act. But thinking just about exchanges, we are working with clients to do financial modeling to see the dollars and cents of staying with the current multi-employer plan structure or moving participants to an exchange. And what we're learning is that in most cases and in most industries, it makes more financial sense to stay with the current structure. There are winners and losers, and those need to be looked at, and we're working with clients to do just that. There are also differences in the exchanges state to state, and the exchanges are still very much in formation. So we'll likely see changes over time and need to revisit some of these issues. Another aspect of understanding the Affordable Care Act that we are working very closely with our clients on is making sure that they are giving their participants an understanding of the Affordable Care Act, what they need to do, and what they need to understand. In most cases, participants don't need to do anything differently than they're doing now. And plans are communicating with their participants to let them know just that. You have coverage, it meets the requirements of the Affordable Care Act, and you can keep that coverage just as it is. Plans are also using this as an opportunity to communicate more with participants, so the participants understand, in fact, how good the coverage they have is, how their coverage is better than what might be available on a state exchange or health insurance marketplace. That their participants, their employees, are eligible for this coverage and continue to remain eligible. Our clients, our multi-employer plan trustees, are finding it very, very helpful to communicate directly with contributing employers and to assure those employers that they're doing everything they should be doing and their obligations are being met under the Affordable Care Act by contributing, based on collective bargaining agreements, based only on the hours worked, in most cases, to multi-employer plans, and in those ways meeting their obligations under the Affordable Care Act.